All right, let's get this party started. Okay. Welcome. We're about to get class started. Welcome to Racial Disparities in Healthcare. I am Dr. Appleton. This is our 12th week. Sorry, it's our 11th week of the 12 weeks of Racial Disparities in Healthcare. Welcome as you come in. If you can hear me, just drop a purple heart in the comments. I look forward to getting class started in just a bit. Waiting on a few more people to come on. So join in, comment, drop a purple heart if you can hear me. Welcome to Racial Disparities in Healthcare. Welcome. I'm excited, y'all. I am excited. Let's get started. Y'all can hear me? If you can hear me, drop a purple heart. And I know we're good to go. So I'm going to give it a few minutes. We're in the 11th week. Time flies when you're having fun. Like, we're in the 11 of 12 of racial disparities in healthcare. Can you say consistency? One thing about me, I'm going to be consistent. Okay. And to affect change, you have to be consistent. And to see change, you have to be consistent. And to be the change that you want to see, you got to do something. So, with that being said, I'm going to go ahead and get started. Before I start, I just want to say thank you. I want to talk about the people who purchased the professional development certificate during this time. I greatly appreciate you for entrusting me to aid in your professional development as it relates to racial disparities in healthcare. It really means a lot to me, especially being in between business deals and contracts. I just want to give a special shout out to a few people who did get that. I see Q Hall, you should have received your package, and you were one of the first people to purchase your professional development certificate. So, for that reason, you got yours mailed to you. And then the second person we chose through the randomizer, and they will be receiving theirs shortly. But it does me a great it warms my heart because essentially uh being a business owner, being in between business deals and contracts, business being slow, this was something that I genuinely enjoy doing. Even today, feeling tired and drained, and I'm like, you know what, I'm gonna get my energy back. I'm gonna get my energy back once I hop on live to teach. And sure enough, so this is my lifeline right here, teaching. If I wasn't teaching y'all, I'd be teaching somewhere else. But you're welcome, and I thank y'all for joining in. Thank you. The glasses are from Top Notch Eyewear. Okay, see the difference. The difference is seeing top notch. Anywho, so what I want to get into today is I'm gonna get right into it. Usually I give it about 5 minutes, but with that being said, after the 12th week, the videos will not be available, y'all. I got a learning management system that the classes are going to go on to. So those of you who got your professional development certificate, congratulations. There are a few people who did reach out to me on the side that wanted to get that. And the opportunity is still there, but you have the final date will have to be April 10th, because after that, I'm scrubbing the internet of those videos and they're going into the archive onto the learning management system that I've been working diligently at creating, so that this way people can, the content is already there. So it'll be self-paced. There's no live videos and all of that good stuff. So, I'm a business owner. I'm an entrepreneur. I gotta pivot and I gotta move and I gotta make things happen for me. Okay. But I want to get into a special topic that was near and dear to my heart. Earlier this week, I was invited to speak on a panel that spoke. The panel was about women in healthcare. And so I was one of the people that they had me to speak about minority patients, minority women as patients in healthcare. And so I did a presentation and I was like, oh, I'll just present this in class because, of course, as we're coming to the end, we've pretty much learned everything that there is to learn. Now it's time to put it in practice, right? And so, being that this is week 11, it's like a semi review, but not really. I'm going to introduce some new information as it relates to statistics. And then we'll go ahead and next week we'll kind of get into the next class. So this way you have an idea of what it is that you want to do. So I was invited to speak, and that's what I'm going to present to y'all today, because I didn't present them the whole thing because I was like, oh, I don't know how much time I'm gonna have, because I get passionate and I get overzealous and I could go and go and go. But with y'all, I got a little bit of time. I got like 45 minutes. So we're gonna hop right into it. So I spoke about minority. Bree, welcome. I want to give you a shout out. You were selected randomly to get your certificate mailed to you. So that will be coming shortly. Anywho, so minority women as patients in healthcare. Y'all know it's going to say minority, but when I'm talking from the experience of a black woman, as a black woman in healthcare, as a black woman in as a patient, a consumer of healthcare, and as a provider of healthcare. So y'all know I had to tell them who I was, but I did dive into the fact that I did publish 2 books, one of which was a requirement for this course. And then I had the pleasure of telling them about, these 2 books and how I implemented those into healthcare spaces. So some things that I discussed: minority women as patients in healthcare, more specifically as a black woman in healthcare. We face health disparities, systemic biases, barriers, and what can healthcare professionals do? If I have any healthcare professionals on the live, drop me a purple heart right now, okay? So, some health disparities that we've looked at so far, and some might be new because I don't think we went over a whole lot of them. We just went over what are health disparities and then tied it into what makes it a racial health disparity. And then we looked at what was an implicit bias. So we have the reproductive health, right? Vascular disease, pain management, mental health, autoimmune diseases, cancer, menopause, and aging. Like, these are some things that are health disparities when it comes down to us women in healthcare. And I wanted to take a closer look for you to have the information that when it comes down to maternal health, which is why I wrote the book Nevertheless She Breastfed Despite Racial and Cultural Disparities, and my bachelor's being in health science, concentrating in maternal child topic, but then furthering my education to the point where I got my doctorate. And I was like, I saw a need, right? Having your doctorate means you're somewhat of a problem solver. And so I saw a need throughout my educational studies that did not necessarily put minority women at the forefront of a lot of the statistics. We did not learn about maternal mortality. That was something that I learned during my own um, studies and research, right? So higher mortality rates, black women and indigenous women are among the group that has the higher mortality rates, right? Why? Because of inadequate prenatal and postnatal care. Mind you, it's not that prenatal, but maybe let me tell you something. That postnatal, it lacks. When you look at what happens in other countries, hence why I concentrated in global health. When we started looking at other countries, it was like, oh, they have great postnatal care. They have lower rates of postpartum depression. This was higher amongst, marginalized group, black women, indigenous women. Um, women are the women are underdiagnosed and undertreated for heart disease. But black women, I think I discussed a little bit ago that black women are number one as it relates to heart disease on the list, okay? With stress and things like that. And clinical trials have historically focused on men, limiting the understanding of how heart disease presents in women. Women's pain is more likely, and black women more specifically, black women's pain is more likely to be dismissed or minimized by healthcare providers. And conditions like endometriosis and fibromyalgia are some of the misdiagnosed or diagnosed late. And so when we consider these things, and I don't even, my next level of study and interest and research is women's health, black women's health as it relates to menopause and aging. Because I myself, perimenopause is creeping up, is right at the door. So we have to be able to, put ourselves in these situations to elevate research for the advancement of healthcare. Tapping into my next point: systemic biases in minority women's health, historical exclusion from research. I previously mentioned when we're talking about heart disease and heart markers and blood markers and who high cholesterol and things like that, it does not take into consideration women. It always has taken into consideration white men. So when we're looking at the historical exclusion from research, women were systemically excluded from clinical trials until the 1990s. So 1990 is not a whole lot of years ago. So we're still kind of far removed as far as being in the new age and the age of progression, where we don't have a lot of research as it relates to what is necessary when it comes to women's health. because for the longest time, women were not even seen as people. Okay. We have gender bias in medical education and practices. So, medical training often overlooks or minimizes women specific health issues. I get people calling me all the time. And a lot of times I just recommend just find a new doctor. Like, it is trial and error, unfortunately. But because I am not a medical doctor, I am a doctor of research in health science as it relates to global health. I can just let you know, hey, find you a doctor who is has advanced their education and is more so into research than anything. Maybe they have an area of specialty. Not all gynecologists focus on women's health. They just doing the pap smears and sending you on your way. So if you go to your gynecologist and you're expressing some concerns and immediately they want to bring it back to your weight, there is a little bit of implicit bias there, which we discussed in like week 2 or 3. Racial and ethnic disparities. So again, teaching racial disparities in healthcare, we identified that not all racial disparities are going to be racial disparities. Some of them are implicit bias. Like if you are a woman who might have a little bit of a issue with your weight, and you're telling your doctor that, and they're treating you different because of your weight, not necessarily because of your race, there's an implicit bias there. But when we're looking at the ethnic and racial disparity, Black and Indigenous and Latino women face compounded discrimination in healthcare. That compounded discrimination means not only because you're a woman, but also because of your race. So when we're looking at that, we're like, oh, this is a problem. Hence why I'm here teaching racial disparities in healthcare. Economic inequalities, economic inequities. We looked at some of them, listing out some social determinants of health, understanding that where you're born could be the issue, understanding that you might, where you come from might be the issue, might be out of your control, might be in your control. But when we lump it all in together, we're all not so far removed, right? We're all not so far removed. And I've corrected myself, because I used to say statistics would say everyone is like one medical bill or one paycheck away, or one losing their job away from being unhoused and entering into a different socioeconomic status. When in reality, there's people who are working, and that does not keep them away from being in a lower socioeconomic status just because they're working, right? And so lower incomes and caregiving responsibilities can limit the time and resources for healthcare. Again, if you have a job that doesn't offer PTO, you can't be taking off work to go to a doctor's appointment. You can't take off work to go to a doctor's appointment. Political climate is now becoming an issue in racial disparities. Yes. Again, be- I saw someone say they asked their therapist about who they voted for, and they had to change their therapist. They did not divulge what the therapist answered. But again, yes, the political climate is now becoming one that is of a racial disparity as well. You got to ask, and even if you have to ask, we have to be diligent in this time, especially for our mental health. When we talk about LGBTQ plus and trans women's health, trans women and lesbian, bisexual women face discrimination and lack of provider knowledge. If the provider started becoming a doctor back in the 60s, I mean, come on now. Do you really think? I mean, not to say that all, but to some degree of a certain demographic, there are certain doctors who they won't even they do pick and choose what patients they want to help. While that may be their right, it is also your right as a healthcare consumer to pick and choose what providers you want to attend to you. But then there's limited access, right? Because we see what's going on with trans women. And if you're a Black trans woman, then there's even more racial biases and racial inequities that they face. Okay. Lack of representation. Few women, especially women of color, in leadership roles in healthcare and in research. I always would tell my students, whatever research, I even have a link in the description of the videos. There's a link where you can book a 15-minute call with me if you are a student who is in research, because I encourage all students. Your research doesn't have to be this big, grand finale, but you can get it published. That was one of the first things I learned in my bachelor's, was how to get my research published. And that has taken me so far because, again, we need to see representation. I need to know that when they look up that research, they see my name and they go look my name up and they find me on LinkedIn and they see that I'm a Black woman. That does me some justice because people are looking for representation in these healthcare spaces, especially now when we're talking about literacy rates and things like that. I always like to touch bases with my students and let them know, hey, I've been where you've been, and not like in a, oh my gosh, if you can do it, if I can do it, you can do it. No, but if I've been where you've been, and if you just allow me to mentor you, and if you remove a little bit of the attitude, we can work together for your greater good, because I did it already, but I'm not telling them that. But for your greater good, for the advancement of healthcare. Because if you're passionate about this thing, passion can only take you so far. You got to put in the work. So then I looked at some other things, because remember I told y'all I was going to give a little bit of statistics, and y'all know I love the numbers. And the learning never stops. Thank you. Health issues. So just to list out some quick health issues. Maternal mortality. That means having a baby and dying. Mortality is synonymous with death. I don't know if I can say that right here on the video like that. But Black women, I have it listed in a column, so it looks kind of like this, right? And so I have the health issues, I have the group most affected, and Black women 3 to 4 times higher. Okay, 3 to 4 times higher. Breast cancer mortality, Black women 40% higher. Now that 40% is 40% higher chance of being diagnosed late. Comparison to white women. Okay, 40% chance of being diagnosed late. Cervical cancer mortality, Black women 2 times higher than white women. Lack of insurance, Hispanic women 2 times more likely to have lack of insurance. Hypertension and heart disease, Black women the highest among all groups. And mental health access, you have Black, Latina, and Native American women, Native women have lower access. Okay. Then I jumped into some barriers. What are the barriers? Y'all want to list some barriers in the comments? List some barriers in the comments. Let's get a conversation actually going, because I don't want to just talk at y'all. I want to talk with y'all. So list some barriers in the comments, right? For me, I list some systemic inequities. So some things in the system, right? Number one on the list is going to be racism, discriminatory policies, healthcare deserts. Again, I think I've previously spoke to y'all about how healthcare deserts, with the ban on abortion in different states and things like that, there's going to be a healthcare desert where there's people who are still going to have babies, but gynecologists, some won't be able to finish their residency because they have to perform so many abortions, right? Politics, that is also here on the list. Discriminatory policies, to be more specific, when we see that, hey, trans people are not able to get the health care that they need because there's a policy that is coming into place. Executive orders are being written every day that is going to ultimately X out groups of people. And it's not little by little, it's a lot by a lot, right? So provider level bias. So the implicit bias, stereotyping, lack of cultural training. If you don't know the community that you're about to work in, do not work in the community. How do you get to know the community? I'm going to get there in a little bit. But if you don't know the community that you're constantly working in, you don't know the community. You are not there for their greater good because, again, you still have your own implicit bias. Education about health and healthcare, the possibility of segregation returning is making for a nightmare indeed. Because while some people are playing the role of, oh, it's funny, it's ha, it might be a good thing, it was not a good thing. There were communities of people that weren't able to receive the same as other communities. Separate but equal was never a thing. Lack of representation in their community, correct. Communication barriers, language differences. I talked about this in maybe week 4 or 5, where I talked about cultural competency. Right? And cultural competency is not just understanding the ethnic and racial backgrounds of people, but where people come from. What is it for a single mom to bring her kids in? Or even if you see a woman, a black woman bringing her children in, doesn't always mean she's a single mom. So don't address her as such. And honestly, if you just treat everybody the same, it could make for better cultural competent healthcare. Available resources are definitely different. They don't care. Lack of representation in their community. Language differences, medical jargon. I have taught actually communication for healthcare professionals. Somebody was like, "Oh, why communication for healthcare professionals?" I actually spoke at it at a state conference, the Florida Public Health Association conference. It was called Communication for Healthcare Professionals. That class was packed out, by the way. The reason it was packed out because people want to know, some people want to know how can they communicate better with their patients, and other people wanted to know, what does Black Girl got to say? You peep that, Black Girl Say Something. That's my podcast. But they wanted to know, what does Black Girl have to say about communication amongst healthcare professionals? And the big part of it is, don't talk at them, don't talk over them, but talk to them. Get to their level of understanding. But don't talk to them in a way that you're taking away from their intelligence. Don't talk to everybody as if they're illiterate. Be adaptable to each person. Some people don't have range when it comes down to talking to patients. I've been in situations where the doctor sees the patient comes to me, the patient asking me the questions. I say, let me stop you right there. Let me take you back to the doctor so he can better answer your questions. Because while I could answer the question, I'm not getting the pay to answer those questions. And while I have had to answer those questions, it still does not put me in a space where, yes, I identify with all the patients at every level. But the doctor has to do his due diligence, his or her due diligence, when speaking with patients. So speaking medical jargon, that's what we learn in school. We don't learn that to speak it at the patients because they're not the healthcare professional. Cost of care. Oh, communication, lack of interpreters. And doctors, amen. And doctors, don't be so dismissive. Correct. I often tell patients, you hold on in there in that exam room until you can get your questions answered to a place where you understand. Okay. Lack of interpreters. Economic challenges. We have economic challenges. Income inequality, lack of insurance, cost of care. As somebody who's in between contracts and business deals, I can identify with that. As a matter of fact, just before this class, I was having an issue where I'm having to pick up a prescription. It was a prescription that was put in yesterday. They told me it was out of stock and that it would be ready today by 6. And I'm like, okay, that's doable. But then I get a call at 4 that it has to be transferred to another pharmacy because they're out of stock and they don't know when they're going to get it in. And then the insurance, there's 2 prescriptions. The insurance of the other prescription is like, yeah, they'll cover it, but not that particular manufacturer, even though it's the same prescription. So I was like, so what do we do now? Do you put in a request to the doctor? No, I said, what do we do now? And she's like, oh, I can put it on a discount card and let you know how much more it would be. And I was like, if I'm honest with you, I would rather use my insurance. So what would be the next steps if I don't choose your option? And she's like, well, I don't know. And so I said, if I'm being honest with you, I don't think you're giving me all of the options that are available. Can you look into what other options other than paying out of pocket that are available? I know what the other options are, but it's like, do your job, right? And so, as kind as I could be, I was like, would you mind sending in another request to the doctor to change the prescription? And she's like, well, I don't know what they're going to say if I do that. And I was like, well, is that an option? And she's like, yeah, that could be an option. So let's do that. I would greatly appreciate if you do that for me. And she's like, let me place you on hold. And so she places me on hold. And so there is some other barriers, right? Because while we can talk about economic challenges, one of the challenges I didn't face on here is like, healthcare providers are burnt out. I created a lunch and learn course that I would sit in at the hospital and talk about burnout prevention amongst healthcare professionals. And again, the healthcare professionals would come, but their bosses aren't coming to these meetings. Their bosses are the reasons why they're burnt out. That lady probably burnt out. Pharmacists work long hours. We are living in a bare minimum world. Yeah, nobody wants to integrate the level of critical thinking that they should. Like, it's the strangest place to be. Psychological barriers, mistrust, fear, trauma, stigma, right? Nobody wants to go get a diagnosis from their therapist, especially not in the Black community. Trauma, if you had a bad experience with the doctor. Again, for me, I did do a video. I know, right here, the kind of conversation on TikTok is about women and having multiple children and struggling and things like that. Not my fight, not my conversation, because the first thing that comes to my mind is, wow, she lived all of those times. That's the first thing that comes to my mind as somebody who studied maternal mortality rates in the United States. For a woman to have more than 3 children and live each and every time, and there's women who have their first children and they die, their first child and they die. It's a scary world. So the fact of the matter is, my first thing is, wow, I want to know these women's birth stories, because my second birth story alone was enough for me to be like, I've always said that I'm very vocal with my kids. If my second birth story was my first birth story, I wouldn't have had no more children. It was just that simple for me, because at that point I was studying maternal mortality as it relates to maternal child topics. Policy gaps. We see immigration restrictions. We're seeing that right now. Thank you for the rose. We're seeing that right now. Um, Medicaid limitations happening. It's happening. Okay. Lack of maternity leave. It's happening. FMLA doesn't always quantify or qualify maternity leave. Your job is just saying, hey, you could leave for this little bit of time unpaid. It doesn't guarantee that you have maternity leave. FMLA is the Family Medical Leave Act. So it's not always synonymous with maternity leave, right? Those policy gaps. So then I'm like, okay, let's get into the next piece of it. You should talk to my 3 cousins. They all have 6 to 9 kids each. I would love to interview them, because I think that's where I'm going with the next level of research. I want to put that together. I want to hear women's birth stories, because, again, I encourage all moms, share your birth stories with your kids, your sons, your daughters. Share the birth story with them. I think they need to know the seriousness, not to just deter them from having children, but to aid them in being more responsible as it relates to having children, because it's very serious. It is very serious. So when I hear about women having multiples, more than 3, even more than 2, because, again, we've seen it. There's women who have their first child going into labor with their first child. I'm supposed to be attending a conference that is the Black Maternal Health Conference. It's virtual. And last year it was, I forgot what the theme was last year, but they had a portion where they centered it around dads, and there were dads there that were telling husbands there that were telling the birth stories from their point of view for their wife. Why were they doing that? Because their wife or their spouse, their girlfriend, passed away during childbirth. It's that serious. And I wish spaces like this were more accessible to people, because it's not a free conference. But I wish spaces like this were more accessible to the general public, because, of course, everyone's in there with their masters and their doctorates, and they work in maternal and they work at a university. But I feel like spaces like that should be more accessible to the general public for the advancement of healthcare, for the education of healthcare. And if you have the video of their birth, you should share it too. Yeah. Yeah. So then I got into the next piece of information. Healthcare professionals, what can we do? What can we do as healthcare professionals? And I list some strategies and I'll give some examples. So some of those strategies are education, representation, community engagement, access expansion, data-driven solutions, inclusive research, and policy advocacy. And so those of you who got the professional development certificate, we spoke maybe like last month, where we were on Zoom and we were discussing like what that looks like, right? I wanted to know everyone's background, how it relates. I'll be sending out some templates soon as well, after the class is done, where in that template, you can use it to populate your own research. You can use it to um, populate a policy, because you don't affect change without showing that there's an issue. You don't affect change without showing that there's a cause or a need for change. And so that's what the template pretty much does. It's the same template, whether you want to create a policy, whether you want to get into research, or whether you want to just pitch something to your place of work as it relates to healthcare, even if you're not in a healthcare space. Something like burnout prevention, right? something to that effect, different things in those areas as it relates to healthcare. So I was like, okay, let's get into some of those trainings. What y'all doing right here with me? This counts, right? Education, bias and equity training, cultural competency. The next course to come is healthcare is politics. Or maybe I think I'm gonna take it to a vote, because you have healthcare is politics and you have a cultural competency to combat racial disparities. There's like two folds to it. We get into representation. Hire more people of color, right? If you are in that position, yes, qualifications matter, representation matter just as much, right? I saw Match Day this past month, and I get misty, teary-eyed every chance I get. I'm like, oh my gosh, another one, another one. When I'm seeing like the black and brown people, the men, the women, and they're matching in things like dermatology. Do you know how hard it is? Excuse me. Do you know how hard it is to find a black dermatologist? Do you know? It is rough, okay? To find a black dermatologist to diagnose any scalp issues within our kinky, coily hair. It is rough. I'm having a hard time finding a black dermatologist. And I don't even have the insurance right now that I need to be looking for one, but I'm looking. Okay, so I'm ready for them to finish their residency. Yeah, I love Match Day. Cardiologists and gynecology. Oh my goodness. I have a student right now who's in medical school. I wrote her letter of recommendation as my tenure as a professor. And I'm so proud of her because her final research for her healthcare administration degree was looking at PMCC, which is a cardiac condition that pregnant women get. And I was introduced to this condition, but she had already worked as a paramedic in the emergency room triage for maternity. So health in her hue, I'm listed on there as a provider, as an optician, but health in her hue is where you can find women of color physicians. I haven't found a dermatologist on there. There are a few, but they're not in my city. So I haven't gotten there yet where I could travel to find a dermatologist. But she looked at that disease that affects pregnant women. And I was like, oh, wow, this is so amazing. So, yeah, when I looked at some other things for strategies, I told y'all education. So, training and cultural competency and humility, right? Listen and validate the people's lived experiences. Don't be so dismissive. Diversity and healthcare equity in the workforce. The use of community-based outreach and partnerships. So before COVID, one of the things that I would do is I would write proposals and pitch them to the mayors, the councilwomen, mostly the councilwomen, because they were black women at the time. They still are. There was some Hispanic women in different counties here. But I would pitch these proposals and say, hey, there's a need for breastfeeding due to the lack of representation in this area. Yes, y'all do have a WIC office, but the WIC office is so far and few. So here's what I can offer. And if there is money for that, they will give it. But also too, I love doing it. So I didn't mind doing it for free because business was doing well. If my business is doing well, then I can do it. I've also done some things in my business as it relates to helping young adults who are transitioning out of foster care get eye care services. So I had partnered with an eye doctor. She would do the eye exams and I would do the glasses. Right now, typically that is based on how many people purchase glasses throughout the year versus how many people, because for every two purchases, there would be like one. Right now, we're taking up donations for that because I wanted to do 25 pairs of glasses for 2025. Right now, we haven't even close to meeting that goal. But the reason why I mention that is because how do healthcare providers uh, close the racial gap that is racial disparities? Well, doing community-based outreach. The book that I published, the meal guide, the meal planning guide that I published so long ago was never to be for sale. It was a part of a community call to action that was combating diabetes in the Black community. So what happened was when people came, they got their finger pricks. They got their blood pressure check. They got like the basics, and then they would get the meal plan guide for free. And the meal plan guide doesn't even go into like cooking or anything like that. It's really just giving people basic level skills to set their mindset up, even if they're unhoused. I don't want to say homeless, but even if they're unhoused, even if they're in between places, where can they go in the community and find nutritious ideas to eat? Because not everything has to be a 4-course, 5-course meal where you cook and you have an appetizer. Sometimes it might just have to be tuna and crackers and a fruit. And if you do that a couple times a day, you're getting your protein rich, you're getting your protein, you're getting your small dose of salt, you're getting your fruit, you're getting all of the food groups. So yeah, there was that's what the book was all about. And my professor liked it so much, and she was the one who told me to get it published. So that was my first book that I published. Improve language access, offer professional interpreters. More people can go into, even if that language is not your first or second language, if you're good at picking up a language, get the medical interpreter certification, right? Equal access. We want to provide equal access for the advancement of healthcare. When I talk about certain careers, because again, we see the conversation happening about a certain demographic of men not entering college at the same rate. So what I did when I was in a position to encourage these Black young adult men about education and access, I would open their thought process up to, what are you good at? Because this is a healthcare administration program, right? Most of them were graduating. They're well on their way to being seniors. They're juniors, kind of late to change your major. But what are you good at? Because whatever you're good at, there's a job for that in healthcare. One of my students was like, I'm great at graphic designing. And that's really what I wanted to go to school for. But that's not what my parents wanted me to go to school for. Okay, cool. Did you know that the World Health Organization, United Nations Healthcare, do you know that these people hire people who have a healthcare background who are great at graphic designing for their Instagrams, their LinkedIn's, and the different pages that they have, Snapchat even? Now I'm opening their thought process and their mind. Oh my goodness. I didn't even know that was a job. Yeah, that's a job. What is your interest? There's a job for everything in healthcare. It's not just doctors and nurses, because healthcare is collaborative. It's a full circle. If those people wasn't putting out those infographics, because that's what it's called, it's an infographic. If they weren't putting those out, if you like tech, but you also are in healthcare, there's an area for everybody. Okay. Enhance access to preventative and reproductive services. Again, expand low cost and free clinics. We need expansion. But as we can see, currently we're living in a time of reduction. Everything is reduction. My daughter talks about this all the time. Shrinkflation. The detergent is getting smaller and the price is going up. Okay. She has 19 years in medical finance. People don't know that those things exist. So speak to your counterparts, the young people coming up, talk to them about these types of jobs that you have that exist. I tell people all the time about me being a phlebotomist, because it really just requires one semester. And if you're good with your hands, it's a great job. And then if you're in the field long enough, you pitch yourself and you get paid what you want to get paid. It's just everybody's slow right now. Even the private doctor's offices that I work with, slow. Okay. But again, when they up, I'm up. When they slow, I'm slow. Because that's the way of the business. That is the way of the business. Collect and use data. Track health outcomes by race, ethnicity, income, gender, identity, and geographic areas. Many of you have been responding to the discussions. That is letting me know everything that I need to know for the next level of research for the advancement in healthcare. Include minority women in your research. Include them. We're here. We don't mind, for what it's worth. We don't mind. I hear on the radio all the time, they're looking for, the next birth control pill that they want to implement, and they're looking for Black women ages, I think they said you have to be under 35. And I was like, oh, that's interesting. I myself was a part of research when I was way younger, when being young, you just was doing a little bit of everything for a little money. I was working as a phlebotomist, but when the hospital next to us was asking for people in research as it relates to Gardasil, I was one of the first people in the HPV vaccine um study. I was one of the first people in that study when it was just one shot. Then it became like 2 or 3 shots over time. Screen for social determinants of health and the Center of Minority Voices. So the Center of the Office of Minority Health is a great tool. I've told y'all about that before. Just Google Office of Minority Health, play around with it, get some information, download some stuff, because these things are going away. So in my closing, I just want to say thank you for joining us in racial disparity. Type 11 in the comments. We are in week 11 of our 12 weeks of racial disparities in healthcare. I've been here every Thursday at 6 p.m. Eastern Standard Time, educating, elevating, and empowering you all in an attempt to decrease racial disparities in healthcare. Of course, I'm just one person, but with all of us learning and coming together and educating ourselves. If you purchased the book, I greatly appreciate you. If you purchased the professional development certificate, you are greatly appreciated. And I just want to say thank you for taking the time to learn with me. April 10th will be the final day that you can get racial disparities in healthcare, professional development, because after April 10th, not after April 10th, I'm going to say by April 15th, I have to take those videos down and put them into my learning management system, because it will be a self-paced guided course. And so I'm excited to drop that and launch that. But if TikTok is not here by next week, I will be on YouTube Live. So make sure you're subscribed to the YouTube, because I do go live over there sporadically. I don't have a time that I generally go live, but for class, I'll be live at 6 p.m. Eastern Standard Time if TikTok is gone by the weekend. Okay. So look out for everything that is there. I've been more and more active on my YouTube because I'm getting the hang of still like all the different social media platforms, more than just scrolling, more than just being a consumer, but doing the content thing. And I do more than this. So I greatly appreciate y'all. So thank you for joining. I will catch y'all next week. Racial disparities in healthcare with Dr. Appleton. And don't forget, I'm on Patreon. I do have a podcast called Black Girl Say Something, where this Black girl has something to say. Tune in, because we drop an episode every Friday at 1 p.m. Eastern Standard Time. And yeah, check us out on Patreon. You're welcome. You're welcome. And until next time, I will see y'all. Because remember, for the advancement of healthcare, we believe in healthcare for all. All right. Till next time.